The coronavirus pandemic seems to be taking more than bargained. That's if it was ever bargained for. With 256,238 cases, there we go, 10,496 deaths, and 89,920 survivors, it may be safe to say that there is so much more to be worried about. However, there is a ray of hope as health officials around the world have earmarked safety measures for everyone who takes their health seriously. Joining us this morning to discuss the scourge and possible preventative measures is a public health consultant and CEO, Trinity Healthcare Foundation, Dr. Nseabasi Ekanem. Good to have you on the show, Doctor.
It's a pleasure.
For joining us. Now, Africa's largest city, which stands at 21 million people, is currently trying to prevent itself against the scourge of coronavirus it's become a global pandemic. It's taking over the world. In fact, it has completely slaughtered one of the world's premier healthcare systems, and that is, of course, Italy. But it seems to be easier said than done to contain the coronavirus spread in any community, particularly one on the continent where a lot of communities don't even have access to running water, and the main precaution that you need to take for coronavirus is to wash your hands. What do we do?
I think what we need to do at this point is to ensure that all citizens in Lagos and outside Lagos, all around Nigeria, adhere to hand hygiene. Well, like you said, access to running water and soap is quite limited in some areas, even in Lagos. And that's why we are encouraging as many Lagosians and Nigerians, of course, as possible to ensure that they have their hand sanitizers. Hand sanitizers containing alcohol, alcoholic base to about 70% is effective in preventing transmission of coronavirus, COVID-19, from person to person. We are encouraging as many persons as possible to make sure that they always have their hand sanitized with the sanitizers in public places, in the banks, in churches. Right now, we are even discouraging gatherings that are more than 20 persons in order to limit this infection. But in the meantime, what we are advising strongly is that all Nigerians must make sure they use hand sanitizers as often as possible. But if they have access to running water and soap, that is also very good. But in the absence of that, hand sanitizers are pretty good. The ones that contain at least 70% of alcohol.
Speaking of hand sanitizers, all the stores, many stores that we have visited in the last 1 week have actually run out. And would it
run
be
out or overpriced?
Run out or overpriced, exactly. And would you even advise that people should begin to look at actually making their own sanitizers? Because we've heard, read of some recipe.
Aloe vera and
alcohol-based, even vodka in some cases.
Yes. Well, the doctor just said it has to be over 70% proof.
Yes,
vodka is only 40%.
Unfortunately, it is. And now, let's even talk about social distancing. For a city like Lagos, over 21 million people and still counting, how can you really practically enforce this social distancing policy that seems to be working in some places? How can it work here?
Like you said, it's pretty difficult. For a place like Lagos, it is quite difficult. But again, I think the best we can do now is to encourage as many people as possible to stay at home. If you go to some places in Lagos, you see a lot of crowd in markets. Yesterday I was driving past Oshodi, and I must tell you that the crowd there was quite massive. The best thing we can do is to encourage as many persons as possible to stay at home, so that in places like markets we can have limited number of persons. Again, in banks, in churches, we should limit the number of persons that worship at a time. For churches that have maybe about 200 members, we should encourage them to break their services, split their services to maybe 4 or 5 services, so that they can have about 20 persons per service. That way they can space themselves properly. While working, we should make sure that we distance ourselves. We should not go to public gatherings at this time, because it might be pretty difficult to create that distance of about 2 meters if you are in gatherings like maybe a wedding or or club or burial ceremonies, or just name them. So it is important that wherever we are, let us try and keep that distance as much as possible. If you know that where you are going to will not afford you the opportunity to keep that distance, please and please try to disembark. And again, we are trying as much as possible to encourage Nigerians to reduce person-to-person contact, that is one-on-one contact. As much as possible, if it's possible to work at home, it's good. So for most organizations right now, we are encouraging employees to work at home, and so that we can limit person-to-person contact. But if you are walking on the road, or you are in the marketplace, or probably in a motor park, wherever you are, try as much as possible to reduce the distance. Because what we've discovered lately is that the droplets that comes out from the nose or the throat or the mouth can be suspended in the air for up to about 30 minutes. That means that, person-to-person contact is highly possible. So let us see as much as possible how we can create that distance from one person to the other, at least 2 meters. So if you are going to a place that will not allow you to create that, social distancing, please disembark as much as possible.
Ekanem, if we could use your medical expertise for a second. Weeks ago, my colleague Ketura, to the right of me here, put a question to another doctor about the health benefits of chloroquine in treating coronavirus. We know that has triggered some kind of reactions from the World Health Organization, who have debunked it, but we know that the United States have confirmed that they believe that they will begin to use chloroquine to treat coronavirus. As a doctor, could you debunk this? Is it effective or not to use chloroquine to treat coronavirus COVID-19?
Yes, President Trump made a statement, but I must say that that statement did not come from the Food and Drug Administration of the United States. No, it didn't come from. It didn't come from the World Health Organization. The president only made that in order to allay fears and to give hope to the public that, look, there is a solution. Fine, chloroquine has been tried on some patients, but limited number of patients, and it was quite effective. But again, you look at it, in a clinical trial, we use many people for a longer period of time drawn from different races, because again, when we are looking at the efficacy of this medication, we also look at the toxicity profile. You remember very well that chloroquine was banned so many years ago because of the issue of toxicity. Now we are going back to it. Have we considered toxicity? I know that this is a pandemic, everybody's scared. We are all in fear. We want to see how we can get the solution as quick as possible. But at the same time, if we can remember the thalidomide case after the First World War, you remember that while the war was looking for something that can treat, vomiting, in pregnant women, again, the world did not know that thalidomide will cause, phocomania, where children will be born without hands and legs. We should also be careful. Chloroquine has a known toxicity, and we all know about that. And that was the reason why it was banned in the first place. Now, we are going back to it. We need to be very careful. While I would say that, yes, it is very effective in the treatment of coronavirus, we should be also very careful in noting the toxicity profile and being sure that this will not cause another problem in the long run. For now, I must say that the
Dr. Ekanem, I'd just like to publicly state, because we are currently battling a poisoning crisis in Lagos because of people self-medicating with chloroquine. Now, as Femi mentioned, this is something that I brought up a few weeks ago with another doctor, and I also brought it up with the Commissioner for Health, both of whom stated, exactly as you stated, that they are unaware of the uses of chloroquine in order to combat COVID-19. What I will say, having looked at medical journals and done some medical research of my own, I am by no means a doctor, what they have said is hydroxychloroquine as a mixture in combination with azithromycin is used to combat the spread of COVID-19. Now, it will not cure you, but it definitely will assist in spreading it to other people. Do you have anything to say to that? Are you aware of this?
Yes, I'm very much aware of that. I must say that right now, as it is, like you rightly said, there's a lot of toxicity already. Even in some Lagos hospitals, patients with chloroquine toxicity are already admitted in some healthcare facilities in Lagos. You see, the truth is that when there is a pandemic like this, if you remember in the time of Ebola in 2014, when there was a rumor making the round that salt water can help, you saw a lot of people going on salt water bath. It's the same thing that's happening right now. There's a lot of fear, and people feel that they can even take the chloroquine as a prophylaxis. I really must say that at this time, while we know that chloroquine can be used in the treatment, like you said, of pneumonia caused by this COVID-19 in combination with azithromycin, I really must say that the public has to be quite aware of the intricacies in all of this. We must be aware of the toxicity associated with chloroquine, and the public must be aware of the use of chloroquine. Right now, as it is, as I speak to you, the first case of coronavirus in Nigeria, the Italian national, has recovered. And right now we're using the plasma of the patient has been withdrawn. And that will be it will be used effectively in the treatment of new cases. Anyone that is sick of that is sick with symptoms of COVID-19 should go to a public health facility, and the right set of care will be administered. We are discouraging self-medication with chloroquine as much as possible because the toxicity has untold consequences.
To buttress your point, Dr. Ekanem, a lot of people are currently hoarding chloroquine, so we urge the public to not self-medicate. As you said, the prices of chloroquine have gone up from 8,000 naira to 25,000 naira in the short space of 24 hours as a result of hoarding. So thank you very much for your thoughts.
Yeah, it's very important to actually emphasize that fact. But let's even go to something that is even more troubling. To hear from Lagos State that there are about 1,300 people that are being traced now, to find out if, the extent of the outbreak here in Lagos. How troubling is that? Because it almost seems that the genie is already out of the bottle. Like the Yorubas would say,
we always have to have a language on the show. If it's not Yoruba, it's French. If it's not French, it's Spanish. Say that again in Yoruba for me.
No, I won't say that again. The genie is out of the bottle. Is that what it is? And if it is so, how worried should we be?
The truth is that as we speak right now, we have a number of persons who were on some of those flights that are still not at large at the moment. While the Lagos State government and the Ministry of Health is doing all it can in order to trace those people and have them quarantined, I think the best at this point is, rather than create panic, we should inform members of the public that if they feel, if they have any of those symptoms, they should self-quarantine themselves and, of course, seek medical attention immediately. The truth is that right now, as it is, we may have a lot of people in the public that might have had contacts with these people that have already been diagnosed of COVID-19. And that means that we have a number of persons among us that probably might be incubating the virus, and maybe in the next few days might start manifesting symptoms. But this is not to create a panic.
Dr. Ekanem, we have to take a short break now, but it is something that we will come back with you and continue the discussion on the prevention of coronavirus and COVID-19 in the Nigerian community. Stay with us on The Morning Show.
Right, the COVID-19 has been ravaging the whole world, and that is why it's been declared a pandemic. And Nigeria is not left out. We've been speaking with Dr. Nseabasi Ekanem, talking to us about how to take care of yourself, during this trying times. You were trying to make a point earlier about, responding to the question of whether there is a possibility that we can actually track all the 1,300 people that Lagos State says it is tracking.
Possible. At this point, we need to inform the public that if you have any of the symptoms of COVID-19, you need to self-quarantine and then contact healthcare officials so that the right care can be administered. And also, we need to also let the public know that at this time, we need to support ourselves by making sure that we inform health officials of any development around us. At this time, like you said, we have about over 1,000 persons that we are still tracing. And the only way we can do that right now is to appeal to the public, appeal to these persons through the media and inform them that if they start manifesting any of these symptoms, they should contact health officials immediately. And of course, we should also inform other members of the public that they should be quite aware and they should make sure that they protect themselves and their families. Observe hand hygiene and of course respiratory etiquette. I think that's the best way we can do. Right now we may not be able to get them, but we can be able to pull them to healthcare officials by making the right information to go out to the public.
Okay, and if I may ask, I mean, the psychological impact. So many cities have been on lockdown, places like Italy, you know,
Iran.
Everywhere.
So
It's good
many people,
everywhere.
yeah,
UK closing
and chances
schools.
are that Lagos might be on lockdown. I mean, we're shutting down universities and
Already,
schools already.
tertiary.
Schools and public gatherings of more than 50
What
people.
kind
Absolutely.
of, how do we protect ourselves psychologically so that this, you know, phase can pass without us losing ourselves, whether in terms of relationship, you know, with other people and even relationship with ourselves?
The best thing we need to do right now is to reassure ourselves. We need to reassure the entire public that, look, we are on top of the situation. I remember in 2014 when we had Ebola, there was a lot of public engagement where health officials from the ministry kept informing the public and keeping them up to speed with the developments. I must say thanks to Professor Bayomi and his team. They are doing quite a lot in informing the public. I think what the public simply needs right now is the right information. I was speaking on another TV station a few days ago where I said that, look, some persons in some part of the country are saying that we don't even have the cases. If we actually have a case of COVID-19, why is it that the names are not made public? Which I told them that, look, the patient confidentiality and privacy is quite important. So we cannot at this point release those names. But again, I think that the public needs to be reassured. We need to give them the right information. We need to let them know the progress made so far in the global community and in Lagos, in Nigeria, to combat this pandemic. We also need to educate the public. Social distancing is very important, like we said. Hand hygiene is absolutely important. Respiratory etiquette is absolutely important. I feel that, yes, the panic is everywhere. Like you said, a lot of things, the commodities are really spiking in prices because people are quite afraid of what the future holds. But I think we need to let the public know that, look, we are on top of the situation and that the government and the health officials will do everything possible to ensure that we contain this virus and make sure that the spread of this virus is curtailed as much as possible. I think reassurance is what the public needs at this point.
I think, well, I agree with you, first of all. Let me say assurance is one thing, but I do also believe that there's a difference between assurance and pure fact. And the Director General of the World Health Organization has said that Africa should prepare for the worst as it pertains to COVID-19. Now, it's one thing for us to say, let's protect ourselves and let's just hope for the best. But if you do not take the necessary precautions, you will contract it. It's a respiratory illness. It's something that's easily contractable. It's an airborne virus. Now, we've spoken about countries like Nigeria, in which we inhabit, but also countries like South Africa. The DG has said we're simply not ready on the continent. We may have thought that we were because of Ebola and the fact that we have taken the necessary precautions and learned a lot of lessons from the Ebola outbreak that happened. And as the Commissioner for Health says, we had 4 isolation centers on the mainland ready to go. But if we have planes, we have people, we're looking for 1,300 people, and these isolation centers can only take 100 people. There's a huge shortfall. There's a huge discrepancy already. We have 12 confirmed cases. 11 of those are in the commercial capital of Lagos. 1 of those is outside. Those are the confirmed cases. If we do not actually have available testing for every member of citizen of Nigeria, how do we know that these cases aren't in fact way higher?
Well, the truth is, I must say this, and of course I said it a few days back in a program, when I said that the coming weeks will be quite a challenging one for Nigerians. But I need us to be quite confident and courageous. The truth is that I said this about 2 months ago, that we are not ready, we are not prepared. I didn't see the preparedness. Right now, as I speak to you, we have few testing centers. That is grossly inadequate. we are going to see a number of cases where a lot of suspected cases will be coming from different, not just in Lagos, different states in Nigeria. I think at this point, the government needs to swing into action. It might be late, but it's better late than never. We need to make sure that we activate some of our moribund laboratories to be up to speed to be able to test for cases of coronavirus. The truth is that we will have a number of cases that will be reported in the next few weeks. And we need to ensure that our isolation centers are well equipped, and of course our testing laboratories are also well equipped, not just in Lagos, but as many places as possible. I think at this point we have just few states that have these laboratories. We need to ensure that other states have these laboratories too, so that we can be ready to test all cases of coronavirus. We need to make sure that we have more isolation centers. We need to work on this. Honestly, this is a pandemic that we need to face with all that we've got, and this is the time to act. We must ensure that all health officials are trained on handling these cases, because from the community pharmacy to the hospital, healthcare officials, workers in the hospital, these people would be interfacing with COVID-19 patients. So we need to train them on how to, care for this patient and link them to the right, care. So at this point, I think we need to do a lot in upgrading our system so that we can be able to, battle this case of COVID-19 in Nigeria. It will be difficult.
With you, Dr. Ekanem, even outside of the training, an Italian doctor who was at the forefront of the COVID-19 prevention in Italy has lost his life in the last 48 hours because he had to treat a patient without the use of gloves because they have simply run out. Now, permit me to say, it doesn't seem as though we even have enough gloves and basic healthcare, hazmat suits and protection. Absolutely. Thank you, the face masks, the suits, the gloves to even be able to combat this. If places like Italy and the United States are running out of face masks and ventilator systems and gloves, what chance do we stand?
Like I said, it's going to be pretty difficult. Right now, as we speak, a number of health workers in Nigeria do not have access to these commodities. I said this about 2 months ago, that the government needs to partner with pharmaceutical companies to make sure that we produce this thing en masse. Now that has to come in and ensure that they give rapid approval for the production of some of these commodities. As it is right now, there is a global scarcity of these commodities. So local production is very important at this point. The government needs to ensure that all our pharmaceutical companies, all our biochemical facilities are up to speed and approved to produce some of these things locally so that we can meet the present demand. The truth is that as we speak right now, these commodities are very scarce. But I believe that if we can swing to action immediately, probably we can be able to save the situation to an extent. But we might be facing a very tough situation, but I believe that the earlier we act on this, the better for us.
Definitely agree that time is of the essence. But Dr. Ekanem, I have a question for you there. As a medical professional in Nigeria, you're well aware of our huge population in this state alone. Are you comfortable with the number of 12 confirmed cases? In your medical opinion, do you think that that is the accurate number?
Well, I must say at this point, those are the cases that we know, right? The cases that we do not know, that has not been reported, we really can't say much about that. But like I said, in the coming weeks, we are going to see a lot of new cases. Honestly, that's the truth. We're going to see a lot of new cases, not just in Lagos, but in other states where contacts have been made. But in the meantime, I must say that we have the 12, but we should be ready for very many new cases in the coming weeks, and we should be prepared, to handle those cases. That's the best I can say for now.
Let's hope it's not worse than what we're already imagining. Now, has this outbreak exposed the inadequacies and the huge gap in the health sector of not only countries like Nigeria, but of course the rest of Africa, and indeed countries that you expected that would be above board in terms of healthcare? Germany has very huge numbers of COVID cases. Italy, very obviously, Spain, Iran, all of these countries. This really has exposed, the gaps and the weaknesses in the health sector. But hopefully, the CBN 100 billion naira intervention in the health care sector in Nigeria, hopefully it will make some difference. But talk to us very briefly about that.
I want to say that we shouldn't be so surprised that we're having this, not just in Nigeria, but across the world. You see, COVID-19 is quite a novel virus, I must say that. As we speak right now, I make bold to tell you that we don't know everything about COVID-19. We had other forms of coronavirus, the MERS, the Middle East respiratory syndrome, that was caused by coronavirus in 2002, and then, of course, the SARS in 2012. I really must say that COVID-19 is quite different, morphologically and genetically. So really, the global community is still learning about this virus, and that's why you're seeing a lot of failures here and there. It doesn't really show that the world hasn't been doing so much about this. It's just that it's a novel virus. Honestly, it is new to mankind. I've done personally...
Short there, but it has been an absolute pleasure. I will speak for myself and say that it's been a breath of fresh air speaking with you, because you are so very honest and very, very, very up to date with what's happening. It's been a pleasure speaking with you, Dr. Ekanem.